Here's my point. If the Apollo lunar craft, which was at that point probably one of the most sophisticated machineries in the world, only stays on track 3% of the time, how do we humans do? That's why we have to start, you and I think all the other people in the house, we got to start helping people see, hey, the little things, you're not going to get feedback. You know what? You might be nice to your spouse and she still may be irritable. You might be patient with your kids. They may not follow rules. That doesn't mean we go down to this line and say, it doesn't matter. Who cares? No, to do it over and over and over again. And eventually, if you look at data, and it's not this level, the slope is more like after time, it gets even higher. It's crazy.
Welcome to I Think I Can podcast. My name is Luella Young. I am a woman who believes that we, like wine, get better with age. Age brings us wisdom, intuition, and a level of sophistication that is beyond the reach of youth. I am here to tell you that living a luxuriously rich and fulfilling life is in your reach. I Think I Can podcast will teach you to think differently in order to get different results. Allow me to show you how to do life effortlessly. This podcast is for the woman who is tired of playing by the rules of society, community, religion, parents, and partners. I Think I Can is all about becoming brave, authentic, purposeful, and strong. Listen weekly and you will find yourself living a life you could have only once dreamed of. Thoughts drive our physiology, so channel your thoughts with me into a life truly worth living. Enjoy the show. Welcome everyone back to I Think I Can podcast. And I have the extreme pleasure of having Dr. Faber with us today. He is one of the many psychiatrists and psychologists at the Amen clinics, and we all recognize that name. So today we're going to talk about brain health, and it's been really just the gamut. We're going to go through a bunch of different questions, but again, I just want to welcome you, Dr. Faber, to make some time for us today.
Well, thank you for having me, Lola. It's a pleasure to be on.
Okay, great. Now, I read, I think at least a couple of Dr. Amen's books, and what really attracted me to his work was actually, the way he termed like his spin on mental health. He talked about like he deems it emotional health. And I remember, I really grasped onto that term. I really liked it because I do feel like it's a bit of a derogatory nomenclature that we attach to emotional health. So yeah, let's just start there. What's your what's your take on the state of emotional and brain health right now? What do you feel is going on?
Well, I think you can expand to the word, I think brain health is where things are going. Now, what does brain health mean compared to mental health? Mental health, we used to, qualify people as having a specific diagnosis if you met specific symptoms. Now, with neuroimaging, from what we do SPECT, but also you can add others, PET scan, fMRI, there's this whole RODC criteria looking at what regions of the brain are working too hard or too little or not very much at all, and what symptoms do they manifest. So what does that mean? It means that we're starting to look at the brain at a much deeper sub-neuroanatomic level. All right. So rather than just saying, oh, you've got major depression, meaning you have a depressed mood or maybe irritable mood, plus you're not sleeping well, you've got low energy, you can't focus, your appetite's too high or too low for a period of week, we're starting to say, hey, look at the anterior cingulate cortex. And especially the subgenual, it's sort of a small area underneath. But if you don't know these neurotonic regions, it's going to be hard. We're seeing a higher likelihood that those areas are active. And there are specific treatments you give to help target that area of the brain to function better. So brain health means we're starting to look much more deeply at different neuroanatomical regions of the brain, from the anterior cingulate cortex to the thalamus to the basal ganglia, to the nucleus accumbens, or a reward center, and then taking that data and then saying, hey, what can we do to help this brain work better?
Okay.
So it's a less stigmatizing term, which looks at, it's not you're a bad person or, keep us quiet. It's there's something with your brain, like hypertension, your blood vessels aren't, working as well as they should. And so do? They constrict and you get high blood pressure. People don't hide high blood pressure compared to they do, oh, I got depression or anxiety, or, I think I'm suffering from high functioning autism. I mean, who talks about this? Nobody does, because there's a stigma attached with it. So brain health is the new term. It really is. And if you ask Dr. Amen, the end of mental illness, his book, he goes into details.
Yeah. I read that one. And also, ironically, change your brain, change your grades, because I remember I was studying for my my certification exam for functional medicine, and that was at about like 52 years old, and I'm going, okay, I need I need help with this again. It's like multiple choice, A, B, and A and B, but not C. And,
those are
and actually
questions.
There was a little section in that book that I was like, oh my God, this is so helpful. And, I was giving it to my kids in university and stuff like that. And of course they're rolling their eyes and they didn't read it, but I was like, okay, well, it's your choice. But no, what you spoke about, I mean, it's interesting because as a psychotherapist too, like even working with couples or something, of that nature, you often hear one partner going, I don't understand how your brain works, or, a parent child, it's sort of like, you're delusional the way you think. So my goodness, wouldn't it be helpful if we would just have, this little battery operated portable device that we could just strap on, our partners and our kids' heads, and study which area of the brain is lighting up. But do you do specific, I mean, how about like narcissism and things like that, where someone is extremely egocentric and defensive and has a real difficult time taking another person's perspective on something like that? Do you study that at all?
In terms of looking at people with narcissism and then looking at their brain scans, we haven't done that yet. All right.
Yeah.
But narcissism, depending on your sort of psychodynamic bend, a lot of people would just label it as it's a longingness to feel special. And if you don't feel special, people will act out.
Yeah.
You can look at that and see maybe certain parts of the brain, like, you mentioned just the family, the relationship piece, frontal lobes.
Yeah.
Okay. What do they help with? They help us with making good decisions, not being impulsive, being able to see the other person's side of the story. So like empathy, particularly lower frontal cortex. If you start to see perfusion problems in those areas, there's less blood flow, then your ability to take the perspective of other individuals' feelings, it's going to be less. The same cerebellum. If you look at especially the lateral cerebellum, the cruise area A and B, we're seeing some real fascinating stuff on just how people connect. And if that's not working well, it's going to be harder. Yeah. So this is where things are going. Cerebellum's it's like completely new territory. We used to think cerebellum was what helped with motor coordination, walk, keep your balance. Now we're starting to see it helps with thought coordination. So how fast we learn our working memory, but also now social coordination. How we connect with others, how we communicate, and there's this sort of weird communication between the back of our brain, our cerebellum, and then a part of our location on our cerebral cortex called the temporal parietal junction. There's probably this back talk back and forth on how to connect, relate. So, are those areas injured or damaged? They're not working well. This is all new stuff we're learning about.
That is just so fascinating. Now you're bringing me back to like the reason I went into psychotherapy is I was first a speech language pathologist, and I specialized in working with patients with traumatic brain disorder, and I was always fascinated, depending on the area of impact or infarct, that what their symptoms would manifest as. And so would you have those patients in your clinic as well that you might study or not?
We see a lot of traumatic brain injury.
Okay.
And we see certain patterns of blood flow.
Yeah.
Depending on where you've been hit. Like if you've been hit in front of your head, like say our NFLers, you see a lot of decreased blood flow in our frontal lobes, but simultaneously when you get hit, your head goes back, and second, the back of your brain, the occipital cortex, cerebellum can hit your skull, and then you see bumps back there. So it's a sort of coup, contra coup pattern, which it's nice to know. But the second part is people want to know how to fix it. I mean, like come in and say, oh, here's what's wrong. At least now. By the way, leave your check at the front door. Thank you very much. Thanks a lot. But there's things we can do.
Okay, and that's exactly what I was thinking about as you're discussing your research. So what are some of the things we can do? I mean, let's take an example of a recent and actually you should probably expand a little bit about the SPECT. That's what it's called, right? SPECT.
SPECT, yeah.
Yeah. I mean, that's a big part of the Eamon clinics. That's why people go to the Eamon clinics, correct?
Well, I mean, yes. I mean, if there's our sine qua non, what we're known for is doing SPECT scans. SPECT scans are unlike an MRI scan. We see the structure of the brain. We're looking at the actual blood flow to the brain, where the brain's getting too much or too little blood flow. Why is that important? It tells us the blood flow, how well the brain's working, right? Yeah. So we can look and see on an MRI what the structure of the brain is, but even if the cells look normal, they may not be working well. It's sort of like you and I could be smiling, but internally, I might be unhappy, depressed, anxious. You wouldn't know, unless you asked a lot more questions. So the SPECT kind of goes a deeper level to say, hey, how's this brain working? Even though it looks normal, structurally, there may be problems. The case in point, NFL players, 2007, when they first started coming to see Dr. Amen, they had memory problems, and they got an MRI, and their MRI looked normal. And so the response was from other entities, of names I won't mention, what's wrong? Well, you're just getting older. And Dr. Amen says, well, maybe we need to look at the brain with SPECT and see if it's different than MRIs. And it was like one of these, oh my gosh moments. There was some marked, huge differences in blood flow. So we look at blood flow to the brain to see how well the brain's either working or not working.
Okay. Well, I just feel like every time you talk, there's so many other places that this can be, utilized in? How about like even criminals and what is it called? I'm just thinking,
Well,
testing.
criminal justice system,
Yeah.
Forensic psychiatry.
Yeah.
I mean, I wrote a book on this called Escape, which,
Oh,
yeah. So I wrote a book called Escape, and I'm not trying to market my stuff, but the book's free. I'm not saying go buy it. You can go to my website, and I'll tell you
yeah.
at the end, and download that book for free. Why did I write it for free? Because the people who need it the most, the prisoners, they can't afford books, but it's a book on how to get out and stay out of the legal system forever. Now, that
Mm.
said, if you look at people who are incarcerated, just the stats, roughly 85% of people have a substance abuse problem.
Yeah, exactly.
And then if you look at traumatic brain injuries, it's 7 times higher in the prison system than it is out in the real world. And so now you have to ask is, hey, do we have a health crisis? Do we have a brain crisis? And those that are incarcerated, and then second, what are we doing to address this issue?
Yeah. Yeah.
And that brings in a whole lot of other questions and emotions and things like that.
Yeah.
But
Well, I mean, you touched on it like very, very lightly before, but I think you spoke a little bit of worthiness, or I think what you meant is like going like childhood wounds, right? Like this possibly this deep emotional wound that we haven't healed for ourselves, and perhaps that's why we think and we act the way we do. And thoughts, I always say, thoughts on repetition just become a belief and a behavior that we demonstrate. So is a lot of, like, when we talk about treatment, then what do you offer at the Amen clinics?
well, one, I mean, there's the traditional. We do use medications, not probably as much as the other clinics, but we do use a lot of supplements.
Okay, supplements.
Yeah.
Okay, and sorry, I didn't introduce you as a psychiatrist. I should let everyone know that you are a psychiatrist. So, which means you are a medical doctor, and you have a license to dispense medication to these patients. So, but you just mentioned supplements. So, how does that work? It just, depending on the person, you may suggest medication, you may suggest more supplements, you may suggest lifestyle intervention. What does that look like?
Or do all
Yeah.
of the above. I mean, just over a general parameter, we take a biopsychosocial spiritual approach.
Mm-hmm.
So it's not just one, it's all four. You have to really address and come up with a lifestyle plan that addresses all of them. So there's that piece. Medications versus supplements. What do we use? A lot of times it depends on level of functioning. I mean, if somebody is, like, say, they're so depressed they can't get out of bed, their energy is so low that they're not feeding themselves, they're not going to work. If they're that low energy, we might look at a medication. Say, for example, if your thalamus is overworking, that increases norepinephrine. So things like Wellbutrin or Effexor or Prestige. If you're coming and say, gosh, I just don't feel as motivated, I'm at work, I can't get things done as quickly, I'm not eating as much, I've lost, a few pounds. All right, so they're functioning, but not the level we want. Then we might look at supplements that help increase serotonin. So things like SAMe or betaine TMG. Make sure you have the TMG. For those listening, don't get betaine HCl. That's going to increase your stomach acid. If you have stomach problems, great. But if you don't, you want the betaine TMG instead. And so you can use those. A lot of it too. It's patient choice and preference. A lot of individuals say, "Hey, I'm just not ready to start a psychotropic medication with side effects. Let's go this route first."
Yeah.
Instead.
Interesting. You're talking about stomach acid, and we're talking about brain health.
Well, I mean, the whole, I went back to the 3-year fellowship at George Washington in integrative medicine just because of things like this.
Yeah.
Our stomach, the gut brain connection, leaky gut syndrome.
Yeah.
We're starting to find out a lot more physiologically what goes in our stomach, intestines can affect our brain. And it's like, well, how does that happen? Why do we think it happens? What parts of the intestinal tract from our stomach down to our large intestines seem to be affected? And then what can we do about it?
Yeah.
And we're finding out yes, there is a connection. We're getting a better understanding why. And then second, there's good news we can do about it.
Yeah.
A lot of people come in and they'll tell you, it's like, I do fine, but then I start getting anxious, or I start getting like nauseous, or I'm constipated, and then I just start getting really nervous. And so you may, in those entities, people look at, doing a stool sample and look at what bacteria are growing in their lower GI tract. It's like, you're a brain doctor, you're not a GI doctor.
Yeah.
It's like, well, now we're kind of both, to be honest. I have to understand GI physiology and neurophysiology and wed them together and other ways to treat both.
That's why I was attracted to, so much to Dr. Daniel Amen's books and your clinics, because we're speaking the same language. Absolutely. And so let's move on to, I want to cover, a little bit about ADHD in our youth and even adults. Let's face it, there's, we have many adults questioning whether or not they have adult ADHD. And then also, brain health as we age, because we all start, I think, even the menopausal years, especially for women, go through some big hormonal changes that affects their memory, obviously their sleep, and all that being so important for brain health. And so what is something that we can do for, whether it's supplements that are most prescribed in those areas, or lifestyle nutritional changes that you might suggest? I know one can't, just say, okay, no, yeah, here's the protocol for menopausal woman. We put them on, XYZ supplements or something like that. But in general, if you were, okay, you're a man, so we can't talk about menopause, but 55 and you realize you're feeling a lot more scattered than normal. Your memory is failing. It takes you 10 minutes now to get out of the door rather than 2 because you can't find this, that, and the other thing. You realize that you're eating a lot more fast food, perhaps grabbing this, grabbing that outside the door, as you run outside the door. What in general, what do you see, as being the most sort of like widespread suggestions you might make to?
Well, this is what a lot of, this, one of the things we see is females will come in on that side. So there's menopause, by the way. There's also andropause in men, which is a whole nother. Oh yeah.
I might have to get you on for another.
Yeah, so that's another big term we're learning more about. But so we go through menopause. What happens? We don't make as much estrogen. We don't make as much progesterone. Also, we don't make as much testosterone. Yes, testosterone as well.
Yep.
Now, we used to think, oh, estrogen, where do you find receptors? You find it in our ovaries, in our uterus, maybe a few other areas. Well, lo and behold, we'll find out that the brain has a lot of estrogen receptors, and so which begs the question, well, then what does estrogen do for the brain? One of the things we see early is patients will come in, hey, I'm 55, I don't remember things as well, maybe I got early Alzheimer's disease, and they're really concerned. Let's get a scan, and we see certain patterns of the surface of the brain that are associated with degenerative conditions. But so just by asking some questions, and the audience, if they want to, they can do this too. It's like, hey, okay, got memory problems. So there's different types of memory problems.
Right.
right? So estrogen, and to a certain extent, testosterone too. A lot of times you'll forget things, but everything's like on the tip of your tongue.
Yeah. Oh, word finding?
Yeah. So word finding, it's like I
Yeah.
can't come up with it. I can't, and then you eventually come up with it. All
Mm-hmm.
right. And so that kind of just a little, deeper dive, we see that associated a lot more with females going through menopause. A lot of times, females will come in, they'll look at the surface of the brain, they expect to see all these perfusion problems, and it looks great. And it's like, why am I having these memory problems? It's not a blood flow problem. It's your estrogen levels are low, and
Yeah.
so what do you do then? It's
Yeah.
like, okay, it's like, oh, you want to check estrogen levels. All
Mm-hmm.
right. You want to check progesterone levels. You want to check testosterone levels, and upstream product from making those called DHEA. We usually check that
Yes.
as well. And then
Yeah.
depending on what's high, low, or normal, then you can start to look at some interventions.
Mm-hmm.
Probably the most noteworthy is using bioidentical hormones.
Mm-hmm. Mm-hmm.
What
Yep.
are bioidentical hormones? Those are hormones that have the same exact molecular structure as those your body already makes,
Mm-hmm.
versus semi-synthetic hormones, which are hormones that have a structure kind of close to estrogen or kind of close to progesterone, but they're not quite. So like
Right.
the pill, right? Those are
Yes.
semi-synthetic.
Yes.
With those, there's higher risk of, clotting,
Mm-hmm.
cancer,
Mm-hmm.
and things of that nature. So the
Yeah.
bioidentical are much more favorable in preventing those
Yeah.
types
No,
of
we've spoken, we've had a few episodes on that. Dr. Felice Gersh is I think also from California, and I've gotten her on quite a few times and
Mhm.
speaking about that, the dangers of birth control and, like just not ovulating, period. In young women, how that can produce some long-term effects. But well, okay, that's nice to know that, a little bit more estrogen, or whether, we go upstream to DHEA or pregnenolone, but that there's hope for that. But wow, like I would say that's the most frustrating thing that I go through is the tip of the tongue, the word finding, and to know, it's directly related to estrogen, is extremely helpful, of course. And I mean, but if it could be that simple, right? If it could be, if there's a supplement for every symptom, or, like a pill for every pain, it would be great. But often I think you must see this as well, is we're talking to our clients or our patients about stress reduction and, getting more sleep and things like that. That's unfortunately not as easy. Would you agree?
It's not as easy.
Yeah.
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 Yeah. There's almost an assumption, well, I'm doing this already. And then
Yeah.
and then you start asking more like execution,
Mhm.
questions. And it's like, there's some opportunities here.
Yeah, exactly. Yeah. And so much I feel is, like, why do we have to wait till there's some sort of chronic disease, or, like, why are people not more preventative? It's often like we wait for this diagnoses, or, early, heaven forbid, early Alzheimer's, or, like cardiovascular disease and cancers and things like that. I mean, if we could just start listening to our body, and those lessons that we're getting, like little lessons sent to us all the time and little suggestions, but we're just ignoring. I think we'd be saving, the system incredible amounts of money, but also, like, increasing our quality of life. It's not to say that we're going to possibly die sooner. It's just, our quality of life will expand, extend.
Yeah. Jeff Olson, is there, can we share screens? I can draw
Oh,
something out
yeah,
because
absolutely.
this is something that is so important.
Okay.
Let me try and see if I can do this. Oops. Host disabled.
Okay, so I have
Person
to.
screen sharing. Oh, you got to give me permission.
Okay. I think I just did.
Let's try it again. All right, let's go here, whiteboard. All right, so this is just Jeff Olson wrote a book called The Slight Edge. He just did a.
Is he one of your
update.
fellow?
No, this is a book you can buy at any
Okay.
like Barnes and Nobles. He doesn't work with
Okay.
us. All right, so we'll just call this like success or wellness. Hey, I got this plus where you're got a good job, you're making money, you got good relationships. Minus is, hey, I'm divorcing, I got a health problem, things aren't going well. Now this is time, and this is what we're starting to see with research. It's the small things that you do every day that make the biggest difference, right? We all know that. Eat healthy, get 8 hours of sleep per night.
Yeah, I know. We hear it so often. We're kind of going, yeah, blah blah blah.
Yeah, right. All right.
Yeah.
And we think, most of us think that, hey, for the more time you do these things, get up, read something successful, spend time, quality life with my family, we think it's going to be like a one-to-one relationship.
Yeah.
And that's healthy. And it doesn't happen. All right. The way life works is we'll do all these things, get up early, read something positive, eat healthy, no feedback. Then magically 5 months, 6 months to a year. Bingo. All right. Then there's, and only, by the way, 5% of people, sorry, I'm using my mouse to draw, so bear with me. Do this.
You're doing
5%. Now, the rest, I think we all do this. It's not that big. I'll skip today. Oh, I didn't read. Oh, I had an argument. We'll make up tomorrow. So this sort of lackluster attitude, we don't get any feedback either. Nothing changes. Right?
No.
Then about 6 months, a year.
Yeah.
And this is 95% of the people.
Oh, God. Yeah.
This is what 95% of the people do.
So
now,
true.
Another thing out here is when in the 1969 Apollo 11, right, went to where? The moon. Now, it's what, 256,000 some odd miles? This is a horrible spacecraft. All right, but it's leaving the Earth and it's heading toward moon. Guess what percent of time that Apollo module was on track to the moon?
I have no idea.
3% of the time.
Wow.
3%. And of course, like this, if you miss the moon, it doesn't take much.
Right.
You can't just say, oh, do a U-turn and come on back. It's like, no, it's like have a good time in outer space for the rest of your life.
Yeah.
And so what happened is, so every half hour, there was a gyroscope on the Apollo moon, and it would just measure.
Oh.
And it would adjust. Like, we got to go 0.132 degrees, up or, down to the left or right. It's three-dimensional. So it would stay on track. Now, here's my point. If the Apollo lunar craft, which was at that point probably one of the most sophisticated machineries in the world, only stays on track 3% of the time, what do we humans do? That's why we have to start, you and I think all the other people in the house, we got to start helping people see, hey, the little things, you're not going to get feedback.
No.
You know what? You might be nice to your spouse and she still may be irritable. You might be patient with your kids. They may not follow rules. That doesn't mean we go down to this line and say, it doesn't matter. Who cares? No, to do it over and over and over again. And eventually, if you look at data, and it's not this level, the slope is more like after time, it gets even higher.
That's a great graphic.
Crazy.
Yeah, so, it is crazy. And who's the author of this book again?
So Jeff Olson, The Slight Edge.
The Slight Edge.
Yeah.
Okay.
And the thing about it is, this is the part that's like, for me, people will come and they'll spend a good chunk of change. Right? To see you. It's like, oh, dude, it's good, nice talking to you. All right, we'll see you next week. Well, they see you for an hour, they see me for an hour, and then how many hours are the rest of the week? What in Lord's name goes on when these people leave your office?
Exactly. I know.
What can we do to help incorporate a esprit de corps of brain health, physical health
Hmm.
in our everyday life.
Yeah.
And so my own personal feeling is we got to come up with some other systems to help incorporate that attitude beyond an
Hmm.
hour meeting with a therapist or a
Hmm.
psychiatrist or whomever.
Hmm. You're so right. It's so true. I know. I mean, I have certain clients too that I know spend, as you know, healthcare in Canada is, quote unquote free. But there are clinics that we have access to where we can, pay larger sums of money and get all these scans and MRIs, at our fingertips. And I mean, yeah, I have clients that are, going to those clinics and get the full workup. But as you said, come home and it's the same amount of drinking, it's the same lack of exercise, it's the same, yeah, miserable marriage. Nothing really changes. But they think that getting the scan and having, yeah,
Yeah, you think you spend money. The assumption is I'll spend the money, I'll get the results.
yeah.
Uh, from that experience, you'll get an experience, but it's
Mhm.
what you incorporate after that makes a big difference. There's a new textbook called Lifestyle Medicine, which is it's all about how do you stay on a good diet. How do you
Mhm.
exercise?
Mhm.
The
Mhm.
book, it's that literally. It's like 3 inches thick,
Oh my God.
and it's like people think lifestyle medicine is simple. I
Yeah.
mean, this book, why did they write it? Because they know people we're creatures of habit. It's like you
Yeah.
mentioned earlier. We programmed our brains a certain way,
Mhm.
and how do we change it? And it's like the small changes
Yeah.
every day. It's not these big dramatic. You spend $5,000 or $10,000, go to some health clinic, and
Yeah.
expect to see instantaneous change.
Yeah. I know. It's like, now I do a lot of the Gottman work too, John and Julie Gottman, like for
Mhm.
couple counseling, and I'm sure you're aware of them as well in Seattle. But yeah, John Gottman wrote a book as well, Small Things Often, and it's exactly that. It's like it's actually, your spouse comes home and not just like somehow communicating to them that you are aware that they're home, and you're appreciative that they're home. Like, I mean, it's literally 5 minutes a day of connection he talks about, but focused, deep connection. It's not just hey, yeah, as you stir the pot or whatever. It's like, no, really, like I want to know, right, how your day was, sort of thing. But yeah, we I think it's also the world of immediate gratification, right? The Amazon click and there it is at your door the next day. It's like we're just living in that immediate gratification world. And so if we do this for about a week and we don't feel any different, just like supplements, I have some of my clients saying, yeah, like, are you taking your supplements? Yeah, trying to remember. And yeah, they say six capsules, but I mean, I'm only taking 3. I'm just like, I mean, it's on the bottle for a reason. Take daily and this amount. I don't know. It's
Well, and that's part of the challenges. And then for us, that's why they've written 3-inch books is how do we
yeah.
incorporate a message that will transcend the office experience to real life.
Mhm.
And there it's, asking other intentional and I think deeper questions to say, well, walk us through it, help us understand it. What if you took rather than 3, take 4 tablets, just give it a month and then send me an email, in a
Right.
week and tell me what it's like. So,
Mhm.
behavioral change, it's
Mm.
not easy. Little things,
Oh, it's
they're
it's
not easy.
it's the hardest. It's
Yeah.
absolutely hard. Like, and then we can talk about meditation, or just like the whole idea of what I said, like just sort of like trying to incorporate more focused attention, trying to be, you know, like 100% present with what you're doing right now, and stop multitasking where your attention is scattered, you know, when you think of it, if your attention is a finite unit, and you dispersed it over 10 things rather than the one thing that you're supposed to be doing, then you could do things faster, more accurately, just efficiently. But we don't necessarily believe that's true. We think we're slowing ourselves down. But yeah, I think if there was, so let's talk a little bit about ADHD. What are you seeing? Like, I mean, so we have some people saying, "Oh my God, it's become like a pandemic. Everybody, all youth and so many children are medicated." And what's your take on all that?
Well, one is I think it's gone up, and I think part is just the way the way our brains get trained now. We don't even realize it. But if
Mhm.
as soon as we get bored a second, we'll get on the web and start looking at a site. You're bored at that site, look at another site, and
Yeah.
so you go roaming instead of
Yeah.
doing what I call deep work, and taking a topic, asking some pervasive questions, and forcing yourself to just look at that. Maybe it's 5 minutes or 10 minutes to start off, but doing
Mm.
that. So that's sort of
Mhm.
point one. Two is medically, you got ADD, you come in, we do like a TOVA or we do the CPT, and
Mhm.
we start a stimulant. Stimulants help only one area where we have focus issues, primarily frontal lobes. All right. So people
Mhm.
that jump from topic to topic,
Yeah.
get distracted. And probably we think too, the back of our brain, our cerebellum,
Mm. Mhm.
they can help there. Now, here's the dilemma is there's other parts of your brain, if they're overworking or underworking, you can see problems. Like, for example, temporal lobes, right,
Mhm.
which help control, support mood. If they're not
Mhm.
working well, we're more anxious to get, or more likely to get anxious,
Mhm.
or more likely to get irritable.
Mhm.
All right. So if you're anxious or irritable, what do you think that's going to do to your focus time? It goes
Mhm.
down. All
Mhm.
right. And so we give a stimulant to people with temporal lobe problems. We stimulate our frontal lobes, which may be working well. But what happens when we stimulate the temporal lobes?
Yeah.
People get more anxious and they get more temperamental,
Yeah.
upset, ticked, or whatever other word you want to use. And it's like people go, what the heck? I thought this was going to help.
Yeah.
And so you don't want to give stimulants to people with temporal lobe issues. So there's other
Mhm.
medications or supplements that help here, that part of the
Mhm.
brain. Your anterior cingulate, okay, which is an area right in the front, about an inch in within our brain. If that area of our brain is overworking, we tend to get more stuck on thoughts. So what does that look like in real life? All right,
Mm.
is people with frontal lobe problems, which we just talked about, they'll get distracted.
Mm.
People with anterior cingulate problems, they'll focus, but it's like, I don't know what you're talking about.
Mm.
I'm going to look outside.
Mhm.
I'll watch the cars go by, or
Yeah.
let's go play this video game. And you can
Mhm.
focus on that, but you're not
Mhm.
really focusing on what you should.
Yeah.
All right.
Yeah.
And so those kind of symptoms respond more favorably to serotonergic agents, whether that be, all right, traditional,
Mhm.
Prozac,
Mhm.
Paxil, antidepressants increase serotonin, but there's all sorts of supplements, 5-HTP,
Yeah.
5-hydroxytryptophan,
Yeah.
saffron. I mean, we've seen really
Mm.
incredible stuff with saffron
Mm.
the last 2-3 years in terms of
Mm.
data coming out.
Mm.
St. John's wort.
Yeah.
All right.
Yeah. Yeah.
So
Yeah.
there's
So
other areas, and a lot of people have more than one, and that's where it gets more.
so what would you suggest? Because I mean, obviously not everybody, can run and get a spec scan, but so when they're having the discussion with their general physician, and they're saying, and they're having these complaints, um what do you like? I think what you're saying is maybe don't be, open your mind to other methods. Like try many different things before you decide on more of these common drugs that are given out.
Yeah, I think there's a couple answers. One is as a patient, or if you're a parent, is empower yourself.
Yes.
Get
Yes.
books that talk about holistic care of ADD. Dr. Eamon's book, Healing ADDH. I'm not trying to promote our clinic, but it's one of the better books written on this. And it's like, oh my gosh. And it's written for layperson. It's not us using a lot of, statistical language about, P greater than 0.05, I squared, equals 70. What are you talking?
Yeah,
It's
exactly.
like, we should know, right, as doctors, but
Right. Yeah,
but
no.
the books like this, they'll help you break down and see, oh my gosh, there might be other areas besides the frontal lobes that are causing focus problems, and how can we address it holistically, and if necessary, pharmacologically.
Yeah.
Also, we
Yeah.
talk about other like psychosocial things to do to help as well in those particular areas. So one, empower yourself, because we, as a doctor, when I went to residency, they didn't train us this stuff. They didn't know it. They're not like the doctors are bad doctors. It's just like it takes a lot of time and energy to go and do the research and understand. And when you've spent 4 years, the assumption, at least for me, when I was out, is, hey, I know everything I need to know now.
Yeah.
Which is when you hear Harvard say, hey, if you haven't kept up over the last 5 years, you're old, which is kind of scary. And that's from their business, program. And it's like, well, maybe we need to keep abreast of what's new and forthcoming. And so my point is this: is some doctors, they just haven't had the training yet. So you might have to look around to find those.
Yeah. Yeah. Yeah,
and a lot of these
exactly.
books will kind of give you directions on where to go.
Yeah. That they would be open to other suggestions. So would you say it's, because I personally have read a lot of books on like just the power of focused awareness, and how some of these authors describe it as, I guess just trying to focus, let's say on the breath. Like, let's say we're doing some meditative work in the morning and we're just focusing on the breath, but then we all of a sudden, the thoughts come in about, oh my gosh, I have this podcast interview with Dr. Faber. I want to ask him about this. So then they sort of describe it as your brain being a muscle, and it's sort of like, you're taking your like it's sort of a bicep, and you're just like wrangling it in. The focus, again, the awareness is sort of like, oh no, you're going over here, like pull it back in, pull it back in, pull it back in, and saying, if you do that repeatedly, it's going to train you to simply stay focused on, focusing on the breath is just one form of meditation, but you know what I mean? Would you say it's like the small things often sort of thing? Like, don't disregard the power of that, continually to do it every day. Would you say that's a good?
It's true. I think you have to, I think one of the things is why you're doing it, right? It's like,
Yes.
just do it and don't ask deeper questions.
Yeah.
That's going to say, well, what's the purpose? And,
Yeah.
and that said, and we don't talk about this as much in Dr. Amen hasn't in his books as much, but I think you're going to see a lot more on the ventral attention network and the dorsal attention network. There are two other areas located on the sides of our cerebral cortex that communicate. And it kind of gets back to your saying. It's like deep breathing. So our ventral attention network, which it runs from our lower frontal fields back to our inferior parietal sulcus. All right, those are big areas you have to know. It basically says, why am I doing this? Why? And that's got to be feeding. If you've got a kid and they have a homework assignment, just do the 10 math problems. Okay, that's one way. Another way is, well, what are these problems focusing on? What are they trying to teach you to master? They're teaching you how to multiply fractions, or they're teaching you how to add with decimal points. That's, so you want to keep that in your mind. And then there's your dorsal attention network, which goes from our frontal eye fields, what we're looking at, back to our temporal parietal sulcus, and that starts firing. And what it does is it says, stay and only look at what you're doing right now. So deep breathing, inhale, exhale. Inhale.
Yeah.
Why are you doing this? Because the more you can do this right now, all right, you're done. Little things become much more interesting. All right. And you're not jumping from one thing to another as much when you do the deep breath work. You're teaching your brain to deal with something that's not so exciting,
Yeah.
so boring. Hey, guess what? Maybe we need to embrace a little bit boredom,
Yeah.
you know,
Exactly.
because
Exactly.
in the long run, it's going to help you become a much more successful individual. And there's books that talk about this now. But my point is here is teaching our brain to use both our dorsal attention network and our ventral attention network. All right. So why am I doing the deep breathing? And then the dorsal, inhale, exhale. I put a time limit. I'm just going to do this for 10 minutes. Parents, you got your kids. We're going to do 10 minutes of deep work. These 10 problems. All right. What are they? What are you mastering? You're mastering multiplying fractions.
Yeah.
10 minutes. I just want you to focus on those numbers. I don't want you looking at the screen. I don't want you thinking, about the interview we're doing or whatever else, or the softball game, the football, baseball game, whatever it is. And so you end up using those muscles to work at a deeper level.
So I think because, I've heard different approaches on this as well, where some people will say, well, if your child's having a hard time focusing on like a certain math, okay, we're going to do math for a half hour, and they're just like, but how there were also suggestions about, okay, make it like related to something he is passionate about. So we're talking about, well, we need to know this foundation, this mathematical foundation principles in order to, be the engineer that you want to be. But also, if you want to pursue a career as a bus driver, you're still going to need, like, it's sort of like if you bring sort of the end goal, there's sort of a method to the madness here. Try to make them passionate about it somehow. That, that's also going to be helpful. And I agree, but sometimes, sometimes, like, I think I feel I relate more to your approach, because let's face it, there's certain, like, I have a son who's graduating this year from grade 12. It's sort of, he's all about, like, this is useless information. It has nothing to do with what I want to do in life. Like, he's more of the artistic art, that's the way he's going to probably express himself in life. And like, I think it's more having that conversation with him. It's like, hey, look, buddy, that there, you need a high school degree. I don't care what you do. It's a foundation. So let's practice things for 30 minutes at a time. And just telling me, like, the small blocks is sort of what you're describing, right? Do it in chunks.
Yeah. I like what you're saying. Make it translatable.
Yeah.
Which is that's ventral attention. It's like my foundation. I've had my 20 somethings come in and I say, of your high school experience, what do you regret the most? I said, well, I regret I didn't study math better. I go, math better? I go, why? He says, because I don't know how to do a check. I don't even know how to do a checkbook.
Yeah.
I don't know how to get a credit card. And it's like, they're 22 years old. I go, well, what did they teach you in math? And I'm not saying all schools are like this. You'd go into class, okay, today do problems 1 through 10, and just leave your assignment at the desk when you're done. And so you got students, why am I doing these problems? And they're, flicking hair and joking and things like that. Teachers like, reading, doing whatever. It's like no one teaches how to make things translatable.
Yeah.
Right?
Yeah.
Right?
Interesting. Yeah.
And what does that mean? It means you as a parent, you have to get more creative. You have to understand your child's passions and interests, and then how to incorporate whatever learning into that. I mean, it's like with art, if you're doing face, there's ratios. Where do your eyes?
Exactly.
In the picture compared to where your mouth. How do you make a circle? Geometry for the front part of your face. But then if you're a female, you have to make an oval.
Yeah.
versus a male, more of a square. And how do those ratios work out? Why do you need to know fractions?
Mm-hmm.
Okay, if you want to be a great artist who understands, aesthetics,
Yes. Mm-hmm.
harmony,
Mm-hmm.
in
Mm-hmm.
reality, this is how nature
Mm-hmm.
works.
Mm-hmm.
So,
Mm-hmm.
we've got to, I think,
Yeah.
we need to
Yeah.
get more creative in how we teach and educate.
Yeah. So
And
true. Yeah. It would definitely make a difference. So I know we're approaching probably, the last bit of the hour here. And one other topic I've kind of found very interesting that I hear being discussed here and there is different types of exercise that is going to be more supportive for brain health than others. I don't know if that's, but like, for example, tennis, because you're using more eye hand coordination plus movement. I guess it makes sense because you are stimulating different areas of the brain more, like you're activating the brain more than you would be just doing squats.
well, so quick rhythmic movements that change. So
Mm-hmm.
playing tennis, playing ping pong, dancing, playing an instrument,
Mm,
all those, they help our whole brain, but they really help our back, our cerebellum
okay. Okay.
work better for learning. It's kind of
Mhm.
crazy, just not just for learning that, but for just working memory and how to keep several, kind of ideas floating around your head
Yeah.
at the same time.
Yeah.
So there's that piece there. Now, exercise in general, squatting, resistance exercises, or running, that's going to help your whole brain. It's probably not going to help that cerebellum as
Mm,
much.
mm-hmm.
So, what we encourage is, if you're going to exercise, uh, we recommend 55 minutes. And that, again, get the big fat book up because not everyone does that. Spend, maybe 10 minutes doing quick rhythmic exercises. And then the other, 55 or 45 minutes doing resistance training, cardiovascular training
Mm.
there.
So break it down again, 55 minutes daily of
Exercise. So this is what I suggest
okay.
is there's coordination exercises,
Hmm.
tennis, whatever. And if you want to do it more, you can do it more,
Yeah.
but at least 10 minutes doing fast rhythmic changes. And then the other 45 minutes, you want to spend half doing resistance. So doing the squats, weights,
Yeah.
push-ups, whatever it is you like to do. And then the other, half of that you want to spend doing cardiovascular, whether it's, biking,
Hmm.
running, and some people don't like going to the gym. So even just getting outside walking,
Mm-hmm.
or
Absolutely.
biking. No
Yeah.
Sweat by Michelle Segar, Segar. She's written a book on how to help people learn how to exercise. The reality is a lot of people just don't like the gym. It's,
Exactly. Yeah.
so this book kind of helps from a science perspective what we do to help reinvigorate ways to exercise, start doing body movement, why you do it.
Okay.
Uh,
So her first name?
Michelle,
Michelle Cigar.
yeah, Segar, No Sweat,
Okay.
great book.
And then the huge lifestyle like door stopper book was what was the name title of that one?
Oh, The Slight Edge.
This like oh no
Yeah,
no that was the one that showed the great graph.
yeah.
But no, you talked or like were you referring to a specific book when you said 3 inches
Oh,
thick?
Lifestyle Medicine.
Yeah,
I can't
lifestyle
think of who
medicine.
it's a textbook, but Lifestyle Medicine.
Yeah, yeah. And then the one other, and this is my interest. I'm not saying everybody else is interested in these books, but the one book on ADHD for youth that Dr.
Healing,
Amen
yeah,
wrote.
Healing ADDH.
Yeah. What year was that he wrote that?
Oh my gosh.
Okay, but it's
There's
been
two.
yeah.
It went from I think 6 to 7 types of ADD, but
Hmm.
and I
Hmm.
can't remember when it was updated. But it's been out for
Many
good.
years. Okay. Yeah. I know. And is he still writing? He's
Still
still
writing. Oh yeah,
oh wow. Okay,
yeah,
great.
still writing.
Good stuff. BDNF. we all hear about how that's fertilizer for the brain. Can you just touch on that?
Well,
Brain.
we're learning more. Brain-derived neurotrophic factor. What is it? It's a cytokine or a chemical that
Mm-hmm.
is made and then secreted by our neurons and probably other cells as well that
Mm-hmm.
help neurons grow.
Mm-hmm.
Right. So a neuron's got like its cell body,
Yep.
and then it's got this long tail called the axon. And
Yep.
then on the other side, it's got these little like roots, we call them dendrites. So think
Mm-hmm.
of it like a plant. And so
Yeah.
what the BDNF does, it helps the axon grow and make
Mm.
connections with other cells. And those little sprouts, the dendrites, it helps them grow and
Mm-hmm.
make more connections. So the more connections, usually the better we feel. We have less connections. One of the things we're seeing, people get more depressed, more
Mm.
anxious. So how do you increase it? Diet, we know.
Mm-hmm. Mm-hmm.
Exercise, we know helps. Those would probably be two of the biggest ways
Okay.
to
Okay.
start. Yeah.
And like, so what's a day in the life, like in terms of your lifestyle, knowing what you know? Can you just sort of like the type of, I know it's no one diet, like we're all, we all optimize our health through different diets, but just even foods, like would you say, would you agree that there's, specific foods that tend to be better for the brain, obviously than others, but like, how about just sort of like, how
I
do
mean,
you
there's different types of diets. I mean, personally, the way I start, because, there's a ketogenic diet, there's,
yeah.
diabetic diet, there is, a high protein diet. I like staying with Mediterranean style diet,
Mm-hmm.
you know,
Mm-hmm.
which is lots of protein, chicken, fish, low fat beef,
Yeah.
and then lots of fruits and vegetables, ideally for
Mm-hmm.
four vegetables and two fruits per day. If you go by what the American Academy of Anti-Aging is saying right now,
Okay.
probably 10 vegetables and fruits per day, which is insane. Who does that?
Yeah. Yeah.
And then stay away from your simple carbs. What's simple carbs? Your junk foods. So,
Mm-hmm.
cookies, candy, ice cream, but even like breads and pasta,
Mm-hmm.
especially for some sugar,
Yeah.
you try
Yeah.
to stay
Yeah.
away
And
from those types of
and
things.
and how about like um fish oil supplements? I know there's a lot of like, what does the Amen Clinic say towards? I mean, some people
Omega
say,
threes. All right.
yeah.
So omega threes. Um, I remember fish oils tend to hang out in our cell membranes. We need
Mm-hmm.
them to help our membranes just move better. In our red blood cells, we want to see about 8% of that cell be omega 3s. Most people are about 4%. In our brain,
Mm-hmm.
I just saw this, gosh, it was about 6 months ago. 25% of our neurons should be omega 3s.
Wow.
And so, yeah, it's a lot. So if you eat a lot of fish, you're going to get a lot of omega 3s. Most people don't eat that amount. So you want to
Right.
get on a good omega 3,
Yeah.
usually roughly around 1,500 milligrams twice a day if you're an adult,
Yep.
with a 3-to-2 EPA to DHA ratio. So EPA and DHA are two types of omega 3s
Yeah. Yeah.
that kind of help our membranes work
Mm-hmm.
better.
Healthy membranes. Yeah.
Yeah.
Better connections. Okay, great. And it's funny, like, and I'm a big nut lover. Like I love, like, specifically almonds. That's why I need to live in California, but in walnuts.
Yeah.
But yeah, and I have to laugh. Like every time I pop a walnut in my mouth, it's sort of like, it looks like a brain. And so it's sort of like, okay, this is for my brain. But almonds I know are more made up of omega-6 than omega-3s, and walnuts is more omega-3s or omega-6. So it's interesting. Like I do measure my omega 3s and omega-6 like every 6 months or so, and I think eating more walnuts actually helped bring up that ratio a bit more, because I know we get so many omega-6s everywhere else in our diet if we're not watching the amount of processed foods. So it's it's a big deal, I think, as well. So
Yeah. So the omega 6s are more what? They're more inflammatory,
yes,
right? And they
right.
produce cytokines that are
Hmm.
inflammatory. where
Mhm.
the omega-3s tend to be more anti-inflammatory. So that's a
Yeah.
whole nother
A whole nother,
conversation.
whole nother thing. Okay, well, I'm gonna let you go, and thank you so much. It's you guys. I'm recording this. We started at 8 a.m. CST, and Dr. Faber was kind enough to start at 6 a.m. PST. So I really appreciate you and all the work, and I will hopefully be, interviewing more of Dr. Eamon's staff. And you have clinics, maybe just mention that, like 3 different clinics in the
No,
US
we've
now?
got like, I think 7 now, or maybe 8.
Wow.
There's San Francisco, Encino, which is in Los Angeles, and then Orange County and Costa Mesa.
Mhm.
There's a clinic in Bellevue, Washington. There's a clinic in Dallas, Texas. There's a clinic in Atlanta, Georgia, Reston, Virginia, New York City. They're starting to open up, or maybe open now, clinic in Fort Lauderdale, Florida.
Wow.
In Chicago, there's one in Chicago too. I forgot to mention.
Okay, so that would be the closest for us.
Yeah.
Yeah, or maybe Washington, depending. So, okay, well, I'll let you get on with your day. And again, thank you so much for your time.
Great, Luella. Have a good
Okay.
day.
You too. Bye-bye.
Bye.
Thanks once again for joining me on another great episode of I Think I Can podcast. If you liked it, please subscribe below so you don't miss out on any future episodes. And until next week, treat each day like it was your last, because each new day is a privilege that we shan't take for granted. Cheers and have a great week. Bye-bye.